Hello and welcome to Public Health Second Disciple International Students Conference. I'm Zajzon Tamás András. I'm a third-year student at the University of Sapientia, Târgu-Mureș, and in my presentation I will talk about the differences between the private hospital and the state hospital, featuring finances and comfort. Hospital financing is a very complicated process. In Romania there are two types of health systems: the state and the private hospitals. Both of them are financed by the National Health Insurance House, even though there is the private hospital, which is also financed by the National Health Insurance House, but you still have to pay for the treatments. If we compare the two hospitals, the private hospitals are better because the quality of the medical treatment, the comfort, and the way that they treat you is much more better. In Romania there is a habit that after you meet the doctor you give gratuities for his services. Even if this is completely illegal, people still pay a lot. This habit doesn't happen that often in the case of a private hospital. We must mention that the private hospital sector size is still far behind the state sector's size. In the national healthcare system, there are many fields or regions where there are no private services at all. That being said, in some cases, like plastic surgery and high-tech involved services, private hospitals are the only places where a patient can go. In my study, I compared the patient's profiles, fees, hygiene, and other parameters, how we can describe the two types of hospitals. I found that even if sometimes the hygiene is not always so good in the state hospitals, and they don't really pay attention to the patient's comfort, many people choose these types of hospitals because the services are mostly free. Well, actually, it's free if only you pay the regular contribution to the National Health Insurance House. The amount of the contribution comes from the patient's monthly salary, a deduction of 5.5%. Besides that, there is also another 5.2% deducted from the salary of the employees, which the company pays after each person, and also there is a 0.5 special fund for covering the income of a loss for the days of the work. At the private hospitals, you have to pay the fee for the treatments, even if the services are partially covered by the National Health Insurance House. In these facilities, the hygiene is better and the patient gets comfortable rooms. These hospitals are chosen mostly by people with strong financial background. In my work, I studied one of Târgu-Mureș's best private hospitals called Galenos. I managed to gather information about their financial status and price policy. I succeeded to analyze financial paperwork from 2012 until 2014. In conclusion, I point out that the private hospital is more attentive to the patient's needs and comfort. In recommendation, everybody first should go and check out the prices at the private hospitals, but in non-emergency cases, and analyze where the services are better. There are some situations where in the two kinds of hospitals the costs are almost the same, but the treatments and the services are much more different. We reached the end of my presentation. I hope you enjoyed it, and next time when you go to the doctor, I think you will do the right decision to choose the right healthcare that cares.